At the inauguration of the first regional conference for the International Society of Pediatric Dermatology, Minister of Health Dr. Ahmed Al-Aoudi stated that scientific research is the first step to solve health problems in children.
The three-day conference with international cooperation will discuss the latest developments in dermatology files and treatments, and is accompanied with workshops to showcase rare cases and reach scientific recommendations. More in this report.
The Minister of Health, Dr. Ahmed Al-Aoudi, confirmed that scientific research is the beginning to solve and answer the majority of health problems in children, noting the ministry's interest in derma diseases in children in recent years. This came during a speech by Minister Al-Aoudi following the inauguration of the 3 days conference of the first regional conference on pediatric dermatology, which is organized by the ministry's Dermatology Department Council, in cooperation with the International Society of Dermatology and the Kuwait Institute for Medical Specialties. The minister also stressed on the necessity of exchanging expertise and continuing to improve the efficiency of doctors and specialists by enabling them to learn about the latest protocols, diagnoses and treatments, as well as the ministry's keenness to establish medical education programs and medical meetings and conferences in various specialties.
I'm delighted to be here at the first regional meeting of the International Society for Pediatric Dermatology, where we'll be talking about some of the latest developments in terms of identifying new diseases, finding the underlying basis for diseases, and learning about new therapies. There's so much happening in the world of pediatric dermatology. We have new therapies coming out for common problems like eczema and psoriasis, and we're learning so much about rare genetic disorders and new ways to manage them.
The conference president and head of the Dermatology Department Council, Dr. Atlal Al-Lafi, for her part said in a statement that eczema is the most common disease among children in Kuwait at a rate up to 25%. Al-Lafi explained that hereditary skin diseases receive great attention from specialists, and their percentage increase in the case of consanguineous marriage, as they appear at birth in the form of thinning of the skin, wounds, chronic ulcers, and skin blisters. And it is possible for more than one child in the family to be affected by them. She pointed out that skin diseases that affect children, including genetic and hereditary ones, are an important focus of the conference activities, noting that the latest treatments related to these diseases will be discussed, especially after the U.S. Food and Drug Administration approved the treatments for these diseases.
This conference is the first International Society of Pediatric Dermatology. It's the first time that it's actually been held in the Middle East, so this is quite a big deal. We talk about the latest updates in the realm of pediatric dermatology, such as mastocytosis, immunodermatology, hair and nail disorders, genodermatoses. All these we will have updates, inshallah.
Dr. Al-Hajji added that the conference highlights the latest development in the field of diagnosis and treatment of derma diseases in children, noting that the conference activities are followed by recommendations that will be implemented in Kuwait, the Gulf and the Arabian world to raise the level of health services in this field.
I'm Mariam Nadwehi for the News Department.